Hey, Mike Savilla here from FamilyMedicineRocks.com, and I'm very happy to bring you some highlights from my point of view of the Kansas Patient-Centered Medical Home Summit, which took place September 30th and October 1st, 2011. Now, what you'll see in this first brief clip here, this is the main lecture hall, and as I zoom out here, you'll see kind of the setup. That's where the slides are for the PowerPoint. As we pan to the left, you'll see the live Twitter stream that was going on, not only people in the lecture hall, but also people off campus giving us feedback about this PCMH conference. And as we pan down, you'll see the people from Image Think, and they were graphically taking notes and representing each one of the sessions during the meeting, which was very, very cool to see. Now, one of the most powerful sessions during this meeting was hearing from patients, and in this next clip, I'm going to share with you the story of Grace, whose child was diagnosed with autism back in the early and mid 1990s when there wasn't that much known about it. And one of the key things in this clip is that she says she's been doing patient-centered medical home for the past 18 years. She's been doing things team-based care. She was the one who got medical professionals together, social work, physical therapy, physicians, nurses. It's a really, really powerful story in this first clip.
My story starts with my pediatrician, who was really a really nice guy, probably the best pediatrician I could ever happen to have. And my youngest daughter wasn't speaking at age 2. So next thing I know, I'm driving to Wichita from Salinas, it wasn't too bad. It's like 5 o'clock at night. I come into Wesley, it's kind of dark, but the secretary's there, and I've got Margaret, this is Margaret. And she takes my information, and the developmental pediatrician looks at me, and she looks at Margaret, and she's less than 5 minutes, and she goes, "I'm sure your doctor told her she has severe autism." I went, "Huh?" And then get this, so she goes into her office, she photocopies a book, brings it out to me, and says, "Here, you get to read about it, and I'll see you later 6 months." So I drive back to Salina, my pediatrician wants to know. And so I go in there, and I go, "Okay." So she said it's autism. He's like, "Oh, yeah, I thought that." I'm like, "Okay, when someone's going to tell me this, but that's fine." I go, "So do I bring her in for developmental checks or whatever?" He goes, "No, I don't want to see her medically. Take her in instead." That was it. I'm like, "Great." So I go home and I call my mother and complain, and she's in the Twin Cities. And my mother's always a classic person that says, worse, life could be worse. She goes, "Well, Grace, you can have this problem and live in Bosnia where there's fighting going on." I'm like, "Oh, great." I'm in Bosnia. My husband is a psychiatric hospital. I've got a son that's got on major medication. Margaret's spinning around and not talking, and I got a book I can get. So I realized I had to do something, and so I created my own medical home. And when I was asked to speak to this, and I was looking at patient action plans, I realized I had been doing this for the last 16 years. Margaret needed help, and I needed more than just her medical doctor. At the same time, I needed to create this home. And it did include medical, social, school, transition, moving from this blob that couldn't talk to who now is a college student at K-State. And where did we get there with
She needed to create this home, she says. Of course, the patient-centered medical home is not a new concept. It's been around for decades. But it's interesting hearing this from the patient's point of view, who had to do this themselves. This next story is from Maria, and she is from rural Kansas. And she is a child who has feeding problems and does not even have a diagnosis for his problems. I've split up her clips into a couple of these. Then this first clip, she just shares a little bit of the beginning of her story.
So my son has a disability, but first and foremost, he's a kid. And he enjoys jazz, he enjoys hanging out with his friends, being with his family. He also has a disability, which is a developmental and a physical disability that is hypotonia, with hypotonia, gross motor delay, seizures, and chronic constipation. So we have a kind of a variety of things going on, and it's nothing that's really a definite pinpoint. Because I am the medical home, I am house myself. I have had the experience of trying to figure out what he needs with not having a path to go on. We started out looking, getting a referral to Children's Mercy to see a developmental pediatrician and a rehabilitation pediatrician, and that was our beginning. And slowly but surely we found that there was a lot of information.
I am the medical home, she said during her story. And when she said that, the whole room just kind of froze. Because we got it. We understood. It was tweeted and retweeted, her phrase, because we just saw this mother who knew there was something wrong with her child but could not figure it out. She tried to do all she can. She tried to get all the information that she could to try to understand what was going on. In this next clip, she kind of reaches ahead. It kind of reaches what she calls a turning point, where she said, hey, I can't do this anymore. I have to get more help for my child.
And a tipping point was a few years ago where it all, the huge light just came on, and I'm like, they're taking my input, and they're asking me, well, how's school going, da-da-da-da-da, and I'm like, I'm telling them he uses augmented communication aids as an IEP, blah, blah, gets blah, blah services, and then I stop mid-sentence, and I'm like, do you know what I'm talking about? And the person said, no. And I said, oh, that was not the right answer I wanted to hear that day. I'm a Mexican mama. I'm just like, the heat got turned on. And I was like, okay. I go, well, maybe you should go and do an observation in a classroom, a special education classroom for a couple of times, and actually find out when a child has significant disabilities or any type of disability, how that plays out in a classroom. What that means, what kind of services does that mean, and what does an IEP look like? Sit in an IEP, and she just looked at me, and I'm like, I'm done. Bring in the next person. And I talked to a medical fellow, and we were talking, and he goes, has anybody ever suggested a feeding study? And oh my goodness, that was the other tipping point. I said, I've come to this clinic for almost 12 years. My son has come to this clinic for 12 years. Nobody's ever suggested that. How would I have known to do that?
So patient stories in this conference, during this conference, were for me the best sessions, because you got to hear from them. You got to hear what it is like to be in this broken healthcare system. Now, another very cool session that happened was talking about social media in healthcare. And in this clip, April Foreman, who is a psychologist, talks about how she used Twitter in a disaster relief situation during the Joplin tornado. You probably remember that. And in her story, she kind of unfolds what happened and how she was able to help get the word out in those first few minutes and hours right after the tornado hit.
So I was getting ready to do a Hickson chat, and a tornado was coming my way. It was the second tornado that was coming my way during the Sunday night chats. And about 15 minutes before it was going to hit us, and we were all, like, I was still getting ready to tweet for the chats, but from our safe place in our house. And the tornado veered and hit Joplin, which is about 30 minutes away from me, which is the major city where we shop, which I know very well because I went to college around there. And so somebody immediately tweeted the police dispatch radio, the feed on lunch, you could hear the radio. And I knew that there just aren't a whole lot of social media people there yet, and nobody was really on Twitter yet. But I could hear the police dispatch string, and I'm not designed for emergency response work. I'm emotionally not made up for that. So this is a little traumatizing. You know, as they say, I found a foot. Or as they say, there are people screaming, trapped in the Walgreens, somebody get a chainsaw. You heard all of that. And the goal was not to sensationalize that, which I did not. The goal was to try to think ahead and do that responsibly while I was sort of horrified. And so me and a couple other locals, you know, would say, don't get in the way of first responders. The police chief needs chainsaws. This is the drop point. The triage points are on these streets. If you need to get somebody wounded somewhere, this is where you go. And I tweeted really consistently every useful, appropriate, and that's hard, that takes some judgment, piece of information I could find in the police dispatch stream for about 2.5 hours until everybody else got on and started doing it. I was exhausted. You'll notice all these people tweeting at the conference. They're worn out because it actually takes a lot of focus. And I tweeted for about 2.5 hours and then just conked out. People got to the triage centers. Things happened very quickly. It was a useful, helpful thing. More first responders, and you don't have to be a doctor to do this. You don't have, but it was a healthcare event, and Joe Citizen can do that. And we should have guidelines to say, if you're a citizen and there's an emergency, here's the best thing you can do on Twitter, because people want to be helpful. People's most altruistic responses often come out during those times. We should tell people what to do. As a matter of fact, I tweeted or called you, didn't I, Ann? And I said, your husband's a first responder. Tell me the top 3 things that I should tell people that first responders want everyone to know. And Ann helped me on Twitter, who I'd never met in person. She's fantastic.
Now, in this last clip from the conference, this is the closing session by Dr. Rick Kellerman, and this is opening thoughts here before his main presentation. And what he talks about is, I'm using his words, he's calling it a historic conference, however you say that. And he describes in this clip how diverse the participants and attendees were. You know, you had physicians and nurses and patients and pharmacists and optometrists, people from industry, realtors. A lot of different points of view came to the Patient-Centered Medical Home Summit. And you can see him kind of reflecting on, you know, the significance of what has happened during this 36-hour conference. It's very, very interesting, this brief little clip here from Dr. Kellerman.
I go to a lot of medical conferences, and there's a lot of doctors there, and once in a while there's some nurses there, there's some PAs there. But this conference was specifically designed to be a little bit different in that there are other members of the healthcare team. And for the 8 pilot programs that were here, if just the doctor was here and the office staff wasn't here, or if just the office staff was here and the doctors weren't here, you really missed something. And a lot of this conference was about the team and about the team effort. What I'm going to try to do, I think there's some other historic, the 4 physician organizations that came together for this entire grant has never been done in the state of Kansas. Now, we tried it about 10 years ago, getting the groups together. That's historic. And then having the 3 funders come together to fund this is also historic. So I just think as we look back, this is going to be a conference that we look at in the future, that this was the tipping point of change in our state. And you folks were here to be part of it.
Now, I'm sure there were a lot more highlights that I left out, but I didn't want to go too far over 15 minutes just for this video. But I do want to thank the people at the Kansas Patient-Centered Medical Home Initiative for the invitation to attend. I encourage you to check out their website at kansaspcmh.org. And I'm also going to be talking about this on my podcast. That's Family Medicine Rocks, episode number 20, which will be recorded on Thursday, October 6th, 2011. And you can get more details about that at Family Medicine Rocks .com. So a very, very fascinating conference. I'm going to be blogging about it more. Maybe I'll be sharing some more video clips from the conference on the website here. But I hope you can join me for the podcast. If not live, then you can download it, and you can get all the information at FamilyMedicineRocks.com. I'm Mike Sevilla, and thank you for joining me for this very interesting, fun, instructional, inspirational video.